Hello everyone. Once again, welcome back to virtual platform of Udainath Autonomous College of Science and Technology. You are watching the UN College Digital Class YouTube channel, and we are discussing on the community health and social work. And in community health and social work, we had discussed about the different infections and different diseases caused by different issues, and we are continuing our discussion about the disease caused by bacteria, means how the diseases are caused due to bacterial infection. And in our previous video lecture, we had discussed about the diphtheria disease and also discussed about what are the cause behind the infection of the bacteria and which causes the diphtheria disease, and what are the risk factors in diphtheria disease, how we can prevent the diphtheria disease, and how we can treatment the diphtheria disease, and what is the diphtheria disease and which bacteria causes diphtheria disease. And also we had discussed about the prevention, treatment, and how we can prevent or how we can prohibit the risk factors of diphtheria disease. And now in this class we will discuss about the another disease which is caused by bacteria, that is typhoid disease. And typhoid is a fever. You all know about typhoid is a fever, and in this class we will discuss about what are the causes for typhoid fever and what are the risk factors of typhoid fever, and how we can prevent the typhoid disease, how we can treat the typhoid disease, and how we can cure ourselves typhoid disease. It means how we can restrict for infection of the bacteria which causes typhoid disease, and what are the cause and the risk factors also. Let's discuss about briefly on typhoid disease. First we will discuss on what is typhoid disease actually. Typhoid fever is caused by Salmonella typhi bacteria. Typhoid fever is rare in developed countries. It is still a serious health threat in the developing world, especially for children. Contaminated food and water or close contact with an infected person cause typhoid fever. Most people who have typhoid fever feel better a few days after they start antibiotic treatment, but a small number of them may die of complications. Typhoid is a fever and which caused due to Salmonella typhi bacteria. And when some persons are suffering from typhoid fever and they can't get treatment at the right time, then sometimes some persons are getting died. And when they have the problem of treatment and when they are not preventing the disease from the primary stage and they are suffering in typhoid disease and seriously, then they are suffering from the typhoid disease. Typhoid disease is rare in developed countries, and when a disease is developed and there is the preventions are available in these countries and those persons are suffering from typhoid disease, they have fear for the typhoid bacteria, and when some persons are suffering from typhoid, they have to cure that disease from the primary stage and contact the doctor or physician at the right time. Vaccines against typhoid fever are only partially effective. Vaccines usually are reserved for those who may be exposed to the disease or who are traveling to areas where typhoid fever is common. And next we will discuss on different signs and symptoms usually include, but in some areas there is the typhoid disease is a major problem, and in some areas the persons are suffering from typhoid disease naturally, and they have no knowledge about the typhoid fever, how they can prevent the typhoid disease. And there is also vaccines available for typhoid fever cure, and are only partially effective these vaccines are. And when some persons are going to these type of areas, they have to take some medicines and take some preventions for avoiding the typhoid disease. And next is signs and symptoms which are usually include, and these symptoms are high fever, headache, stomach pain, and constipation or diarrhea. These are some general symptoms of typhoid disease like high fever, headache, stomach pain or body pain, diarrhea. These are some simple symptoms of typhoid disease. When some persons are suffering from typhoid disease, these are the signs and through which we can detect that person is suffering from typhoid disease. And when a person is suffering from these type of signs and symptoms, then we have to contact the doctor. And if we are not providing the treatment immediately, then the person will getting or the person will suffering from the typhoid disease and suffering from different serious diseases and serious signs and symptoms also. And when a person is serious, then we can't cure that disease from the root, and because of that we have to cure the typhoid disease from the primary stage. And some symptoms which are related with typhoid disease, through which we can detect or through which we can define the person is suffering from the typhoid disease. And these signs and symptoms are likely to develop gradually, often appearing 1 to 3 weeks after exposure to the disease. And when a person is infected by the bacteria, that is Salmonella typhi, through that bacterial infection, the person is suffering from the typhoid disease. And always when the person is infected by that bacteria, after 2 to 3 days of infection, the disease exposed for and the signs and symptoms arises at that person. And before 2 to 3 days, the person have no signs and symptoms, through which we can know the person is suffering from the typhoid disease. And after 2 to 3 days of infection, we can know the person is suffering from typhoid disease and through signs and symptoms of that person. These signs and symptoms are early illness, signs and symptoms which include fever that starts low and increases daily, possibly reaching as high as 104.9 Fahrenheit or 40.5 degrees Celsius, and headache, and next is weakness and fatigue. And so when a person is suffering from headache, and the person is feeling weak and fatigue, and person's fever is very high temperature, and body temperature is 104.9 degree Fahrenheit or 40.5 degrees Celsius, then the person then we can know that person is suffering from typhoid disease from these symptoms. And next is muscle aches, sweating, dry cough, loss of appetite and weight loss, stomach pain, diarrhea and constipation, rashes, extremely swollen stomach. These are some symptoms of typhoid disease. When some persons are suffering from muscle pain, when some persons have more sweating, and they are suffering from dry cough, and some persons are not like to eat, or suddenly weight loss or lose of appetite, and some persons have stomach pain or body pain, and diarrhea and constipation also, and some persons have rashes, means infections in outside or in skin infection. And when some persons are suffering from extremely swollen stomach, when some person's stomach is swelling, then the persons have this type of symptoms, then the person is suffering from typhoid. And next is later illness without treatment. You may, if you are not getting proper treatment, and without treatment what you face, become delirious, lie motionless and exhausted with your eyes have closed in what's known as the typhoid state. Life-threatening complications often develop at this time. In some people, signs and symptoms may return up to 2 weeks after the fever has subsided. When some person is taking antibiotic, or when some person is taking medicines for cure or prevention of typhoid disease, and the typhoid bacteria is not showing, and when some persons are suffering from typhoid disease and they are taking medicine, they are feeling better after 5 days of taking medicine. And when say the person is feeling better, and when the person is feeling that like that the person is not suffering from typhoid right now, then the person avoiding the taking medicine. And after that, when the person is not taking proper prescribed medicine, then the typhoid is returned or come back, and after 2 weeks, which will return, and the person is suffering from typhoid disease for second time. Causes of typhoid disease means what are the causes, which is reason behind the infection of bacteria and how the typhoid disease occurs. Typhoid is caused by bacteria called Salmonella typhi or S. typhi. It's not the same bacterium that causes the foodborne illness Salmonella. And its main method of transmission is the oral fecal route, generally spreading in contaminated water or food. It can also be passed through direct contact with an infected person. The typhoid disease always caused by the Salmonella typhi bacteria, and it's a bacterium disease, and which is caused by bacterial infection, and sometimes the typhoid disease is foodborne illness, and its main method is transmission is the oral fecal route, means through oral the person is infected by the Salmonella typhi bacteria, and which is spreading in contaminated water or food also, and through water also typhoid bacteria entered into the body, and the person is suffering from typhoid fever. And also it can pass through direct contact if we have contact with some persons and they are infected by the Salmonella typhi bacteria, and then the person will face or will infected by that bacteria also, and that person also suffering from typhoid disease. Next is, in addition, there are a small number of people who recover but still carry Salmonella typhi. These carriers can infect others, and sometimes there are persons who recover from the typhoid disease and who recovered from the Salmonella typhi bacteria, but there is some other carriers also infect that person. So we have to cure from the root. Some regions have a higher incidence of typhoid. These include Africa, India, South America and Southeast Asia. And there is some regions which are higher incidence of typhoid disease, and in these countries, in these regions, there is India also included. Worldwide typhoid fever affects more than 26 million people per year. The United States has about 300 cases per year. This is a statistical data. And can it be prevented? It means, can we prevent the typhoid disease? And if we can prevent, then what are the reasons or how we can prevent the typhoid disease? When traveling to countries that have higher incidence of typhoid, it pays to follow these prevention tips. When we are traveling any countries or any other area where the typhoid incidence is in high rate, then what are the tips we have to follow? First tip is, be careful about what you drink. Always be careful when you are drinking any water or any packet, then you have to careful before drinking. And what are the tips we have to follow for careful about our drinks? Don't drink from the tap or well. If you are drinking the water, then don't drink from any tap or a open well. And you have to take feedback before drinking water from any tap or any well. Avoid ice cubes, puff shells or fountain drinks unless you are certain they are made from bottled or boiled water. Always take the bottled or boiled water, and avoid the ice cubes, ice creams, cold drinks and fountain drinks. Next is, buy bottled drinks whenever possible. If you have a problem and if you need the drinking water, then buy the bottled water and which is sealed, and whenever is possible. And carbonated water is safer than non-carbonated. Be sure bottles are tightly sealed, and always be sure and always check the bottle is tightly sealed or not, and after that you can drink that water. Non-bottled water should be boiled for 1 minute before drinking. And when you are taking non-bottled water, then boiled that water before drinking, and after that you can take that warm water. It's safe to drink pasteurized milk, hot tea and hot coffee. If you are going outside, or if you are going or visiting any other areas and where there is the high rate of typhoid bacteria, typhoid disease, then it is safe if you can drink the pasteurized milk or any hot tea or hot coffee. And next is watch what you eat. And the second tips is, when you are taking food, always check that food or watch that food, and don't eat raw produce unless you can feel it yourself after washing your hands. And don't take that type of food or raw produce food when you can peel, or after washing your hands immediately don't take any raw produce food. Never eat food from street vendors. Don't take food from the street vendors, because in street vendors there is different types of bacteria and viruses in these foods, and so if you are taking the food, then don't take that type of food which is available in street vendors and which is not safe for our health. And don't eat raw or rare meat or fish foods. Should be thoroughly cooked and still hot when served. Don't eat raw or rare meat or fish, and always take that type of food which is thoroughly cooked and which is hot at the time of serving of that food. And always take the hot food, and before taking food you can heat that food, or always take warm food. Eat only pasteurized dairy products and had cooked eggs. When you are taking dairy products, then you have to eat the pasteurized dairy products. And when you are taking eggs in your lunch or dinner or breakfast, then you can take the hard cooked eggs. Avoid salads and condiments made from fresh ingredients. If you are taking salads or condiments, then you can't take, or always avoid the fresh ingredients, because in fresh ingredients there is different bacteria, and when you are taking salad or condiments, then you can take that salad through wash that vegetables or wash that raw products, and after that you can take that salad. Don't eat wild game. Don't take wild game in your lunch or dinner or breakfast. Then practice good hygiene. When you are going outside, then what are the good hygienic situation we have to practice? Wash your hands often, especially after using the bathroom and before touching food. Use lots of soap and water if available. If not, use hand sanitizer containing at least 60% alcohol. If you are going outside, or if you are visiting any other place, and if you are visiting through train, flight, bus or any vehicles, then if you are using bathroom and before touching any food, or before taking food or drinking water, then you have to wash your hand through soap. If there is the soap is not available, then you can use hand sanitizer which is containing at least 60% alcohol. And if there is water, then you can wash your hand with soap, which is better. And next is, don't touch your face unless you have just washed your hands. Don't touch your face or any place of your body if you are washed your hands at that time. Avoid direct contact with people who are sick, and always avoid other persons if these persons are suffering from any disease or suffering from fever, cold. Then avoid these persons or avoid direct contact with these people. If you are sick, avoid other people, wash your hands often, and don't prepare or serve food. And if you are sick, or if you are suffering from typhoid fever, or if you are infected by bacteria, then avoid to touch or avoid direct contact with other people, and wash your hands if you are servicing or if you are serving the food for these persons. And if you are sick, then don't prepare food for others. And what about a typhoid vaccine? Means there is the vaccines available for cure or prevention of typhoid disease. And next we will discuss about what about a typhoid vaccine. For most healthy people, the typhoid vaccine is not necessary, but your doctor might recommend one if you are. And when some persons are most healthy and there is no need of typhoid vaccine, or there is not necessary for taking typhoid vaccine, and if your doctor might recommend if you have some issues, and these issues are a carrier, if you are infected by the typhoid bacteria, and if you have other carrier also, means if you are infected by other bacteria, then there is a necessity of typhoid vaccine. In close contact with a carrier, if you have close contact with some other persons, those who have carrier, or if you have close contact with other bacterial infections, then the typhoid vaccine is necessary for that person. Traveling to a country where typhoid is common. When you are traveling to other countries or other areas and where there is typhoid disease is common, then there is necessity of typhoid vaccine of that person. A laboratory worker who may come in contact with Salmonella typhi. If a person is working in laboratory, then there is need of typhoid vaccine for that person, and because the laboratory worker always have contact with the Salmonella typhi bacteria, because the laboratory worker always test blood, stool, urine of different persons, those who are infected by Salmonella typhi bacteria, and the laboratory worker has direct contact with this type of person. So if there is laboratory worker, then there is need of typhoid vaccine for that person also. And the typhoid vaccine is 50 to 80% trusted, source effective, and comes in two forms. There is typhoid vaccine is 50 to 80%, and the source effective, and the typhoid vaccine comes in two forms, and these two forms are, one is inactivated typhoid vaccine and other one is live typhoid vaccine. First we will discuss about inactivated typhoid vaccine. This vaccine is a one-dose injection. It's not for children younger than 2 years old, and it takes about 2 weeks to work. You can have a booster dose every 2 years. The inactivated typhoid vaccine can provided to the children, and this vaccine is a one-dose injection, and it takes about 2 weeks for working of the vaccine, and you can take the typhoid vaccine, which is inactivated typhoid vaccine, in dose every 2 years, which is boost your immune system, and through which we can prevent the typhoid fever. And next is live typhoid vaccine. This vaccine is not for children under age 6. This vaccine is not available for these children, those who are under age 6. And it's an oral vaccine given in 4 doses, 2 days apart. It takes at least a week after the last dose to work. You can have a booster every 5 years. This type of, this form of vaccine is not available for the children, those who are under age 6, and it's an oral vaccine which is providing the children through oral, and it is given in 4 doses, and which is given in 2 days apart, and it takes at least 1 week after the last dose of work. And when you are you want to boost your immune system and you want to avoid the typhoid bacteria, then you can boost your immune system through taking this type of vaccine in every 5 years. Next is, how is typhoid treated? Means how we can treat the typhoid disease. A blood test can confirm the presence of Salmonella typhi. Typhoid is treated with antibiotics such as azithromycin, ceftriaxone, and fluoroquinolones. And we can prevent or we can treat the typhoid disease And if we have any sign or symptoms which is related with typhoid disease, and if there is presence of Salmonella typhi bacteria, then we can treat the typhoid disease through taking antibiotic like azithromycin, and there is some other antibiotics also. And we can prevent or we can treat the typhoid disease through taking medications, and there is need of blood test, and there is need of some other test also through which we can know the person is suffering from typhoid disease, and through signs and symptoms of that person we can detect that person is suffering from typhoid disease. And when we are detecting that person have any symptoms which is related with typhoid disease, then we have to contact with doctor, and we have need of different tests of that person. It's important to take all prescribed antibiotics as directed even if you feel better. A stool culture can determine if you still carry Salmonella typhi. When a doctor is prescribing you medications or medicines or any antibiotics, then and after taking that antibiotics you are feeling good or feeling better, then after that also there is need of stool culture if there is any presence of bacteria in your body. Then there is need of your stool culture, and through which we can prevent or through which we can avoid the infection, and we can avoid the infection of typhoid disease. This is all about today's class. In this class, we had discussed about the typhoid disease and the cause, risk factors, and the prevention and treatment of typhoid disease. And also we had discussed about how the person is infected by the bacteria which is causing the typhoid disease, and also we had discussed about different procedures or different process of treatment of typhoid disease and antibiotics and medicines for prevention of typhoid disease, and which will help you for your prevention and for your cure from the typhoid disease. Thank you. Keep watching. Have a great day.